My name is Jessica. I'm a nurse practitioner student. I'm going to be doing a 2-month-old well infant exam on baby girl Elizabeth here. She was born at 39 weeks gestation via spontaneous vaginal delivery without any complications. Mother received regular prenatal vitamins and care and denies any complications during pregnancy, including gestational diabetes, hypertension, infections, or any substance use. Delivery and newborn transition were uncomplicated, and infant did not require a NICU admission. Elizabeth is formula fed. She takes about 4 ounces every 3 to 4 hours. She's tolerating feeds, no abnormal spit up or vomiting. She has about 6 to 8 wet diapers, and she has normal stools, soft yellow brown, no issues with constipation or diarrhea reported. Parents deny any fever, respiratory distress, cyanosis, seizure activity, or concerns with development. Elizabeth is beginning to smile socially and track faces appropriately. So on my physical exam, her general appearance, she's alert, she is active, well nourished, and in no acute distress. For vital signs, I am going to obtain a temperature. She is normothermic at 37 degrees Celsius. And then we're also going to measure her height, starting at the top and stretching her legs all the way out so we can get a good accurate height. And she is 22.5 inches. And then we are going to measure her head circumference. And for her head circumference, we are 15.25 inches. And then we are also going to get a weight on Miss Elizabeth. And Elizabeth is weighing 11 pounds today. So using the WHO growth chart, this puts her at the 50th percentile, which is good. Okay, so growth parameters appear appropriate for age. And now I'm going to move on to my hands-on physical exam. So first I'm going to do my examination on her head. It's normocephalic, atraumatic, anterior fontanelle is open, soft, and flat, no scalp lesions or deformities noted. Next, I'm going to take a peek into her ears. Okay, and I'm going to have Mom help position Miss Elizabeth so I can get a good look in her ear, pulling in the middle portion and back. Tympanic membranes are present. And observed bilaterally. External ears look good. They're symmetric, no discharge. And now I'm going to move on to my ocular exam. So I'm going to look into her eyes. Red reflex is present. Her pupils are equal and round, and they did react to light. And Miss Elizabeth, baby Elizabeth, is tracking appropriately. Next, I'm going to look into her nose. There's no congestion, no drainage noted. And now we're going to check her mouth. Mucous membranes are moist. Palate is intact without cleft. No oral lesions, thrush noted. The suck reflex is present. Her neck is supple without masses or lymphadenopathy. Good head control for age. Next, I'm going to listen to her lung sounds. Her chest is symmetric with equal rise and fall. I'm gonna listen to her heart tones. And I'm gonna go ahead and listen to baby's belly. Okay, so no increased work of breathing. Breath sounds are clear bilaterally without wheezing, crackles, or shudder noticed. A regular rate and rhythm, S1 and 2. No murmurs appreciated. And then active bowel sounds in all 4 quadrants of her belly. I'm going to go ahead and feel for her brachial pulses. They are present and equal bilaterally. And moving on to her belly, abdomen is soft, non-tender, doesn't seem to be elicting any pain when pressing on. Non-distended, there were active bowel sounds when I listened. No masses, her spleen does not feel enlarged. When palpated, her umbilical area looks like it is healing well. Next, we're gonna move on to GU. I'm gonna remove baby Elizabeth's diaper and her female genitalia externally looks appropriate. No diaper rash noted. I'm also gonna feel my femoral pulses while I'm here. Okay, and I'm gonna put the diaper back on. Excuse me, I'm gonna leave the diaper down and then I'm gonna go ahead and do our hip assessment. So I'm gonna be assessing the developmental dysplasia of the hip using the Ortolani and the Barlow maneuvers. Here I'm gonna be looking for any clicks. Any clunks. All right, no clicks or clunks. Her hips are stable, no signs of dysplasia. And put your little diaper back on, good to go. For my skin assessment, her skin is warm and dry. No lesions, no rashes, nothing abnormal noted. Baby Elizabeth is not jaundice, normal color. Also, her extremities are symmetric with full range of motion. And no deformities noted. For our neurologic exam, I'm going to be testing her reflexes. So we're gonna check, she does have the startle reflex, her Moro reflex is intact. She is moving spontaneously with normal tone for age. I'm also going to assess her rooting reflex, which is normal. She has the sucking appearance in her cheeks. And then the palmar grasp, that is intact and present. And then also her suck reflex is intact and present. Reflexes are appropriate for age. Developmentally, she is appropriate for age, social smile, she's tracking with her eyes, she's cooing, she does have improved head control. And for our plan of care, so overall, Elizabeth is very healthy. She is meeting her expected developmental milestones. We're gonna continue our strict feeding schedule, okay? And monitor our wet diapers and stooling patterns. If you notice any difference in her normal behavior and how she is acting, please let our clinic know. We can definitely get her in. For baby Elizabeth, we want to continue our safe sleep, okay? We want to make sure that she's laying on her back and that in her crib, she is sleeping alone, not in bed with mom and dad, okay? It's very safe. It's very important to keep her safe. We want to make sure that she doesn't have any loose blankets, toys, anything like that in bed with her, okay? Safe sleep habits. We still want to make sure that baby Elizabeth is in her rear-facing car seat, okay? Good, okay, I'm glad we're doing that still. And then we're gonna continue to avoid secondhand smoke exposure, okay? That doesn't just include smoking around baby Elizabeth. We wanna make sure you're not smoking and then having that actual smoke exposure still on your clothes. Okay, good, no smoking. And then we're still gonna do our tummy time, okay? So we'll flip Miss Elizabeth on her tummy, and with close observation, we're hoping she lifts her head up and is able to add on to that continued head control, okay? All right, and then we already talked about monitoring her diaper. Any abnormal vomiting milk is normal, so just a little bit of formula is normal. If we start to see any bile color, that's when we start to get concerned, okay? And then temperature, if her temperature goes above 100.4, we're concerned, okay? So we need to bring baby Elizabeth into the ER if it's a weekend or anything like that, okay? Definitely concerned with 100.4. And then we got a couple of vaccines we got to get today. I know. We do have our DTaP that is due today. We have our polio vaccine. We have our second hepatitis B vaccine that's due. We have Hib, and we have our pneumococcal vaccine and our rotavirus. So we got a lot, okay? We're gonna combine a couple of them to make it a few less shots, and then the rotavirus is gonna be an oral antibiotic, okay? And then we're gonna follow up at her next well visit exam. That's gonna be in 4 months, okay? So she's 2 months old now, so in 2 more months, we'll see baby Elizabeth for our 4-month exam. Is there any questions or concerns or anything I can go over with you guys today that I did not go over or discuss with you? Okay, great. Well, baby Elizabeth looks great and healthy and doing well, so please let us know if there's anything else we can do for you, okay? I'll have my medical assistant come in and we'll get those shots ready. I'll give you a vaccination card on everything. It goes over all the vaccines that she's gonna be getting. And then I'll also have a consent form for you too. And then I have a packet for you that shows everything that baby Elizabeth should be doing within the next couple months, okay? Okay, great. I'll see you in 2 months. Thank you.